Hello, everyone. My name is Sydney Kneller, and I am here with you today to talk about the 21st Century Cures Act. For our table of contents today, we'll start with an introduction of the 21st Century Cures Act, followed by the impact that it has to each party, and then we will end out with a conclusion today. All right, so for our introduction of the 21st Century Cures Act, we'll run through the who, what, where, when, and why. Who does this impact? It really impacts patients, physicians and clinicians, other medical staff, IT developers, and healthcare vendors. What is the 21st Century Cures Act? It's a bipartisan legislation that was signed into law, and it seeks to increase choice, access, and interoperability for patients and providers, amongst other things as well. It is currently in effect in the United States healthcare system. When the act was signed into law by President Barack Obama on December 13th, 2016, and then the why. So this is really to help accelerate medical product development, bring new innovations and advances to patients in an efficient manner, and increase access and interoperability for both patients and providers. It also contains provisions to streamline development and delivery for drugs and medical devices, accelerate research, and improve healthcare services as well. Finally, the Cures Act also seeks to ease regulatory burden associated with the use of electronic health record systems, or EHRs, and health information technology, or HIT. All right. So the Cures Act certainly has impacts to these three parties stated here on this slide. So we'll start out in the top right with hospitals and physicians. So for hospitals and physicians, it does increase access for physicians, as mentioned earlier. Physicians and hospitals also have to ensure that patients have access to their health information, whether that be through a portal or other means of printing their electronic health records. They also must be familiar with information blocking and ensure they're not engaging in it. So there's 8 information blocking exceptions as well that hospitals should ensure they're aware of and that their staff are aware of to protect privacy, ensure security, and prevent harm. Hospitals should summarize the 21st Century Cures Act for their staff as well by creating a checklist that outlines the information needed to evaluate and recommended best practices to avoid that information blocking and better support their staff at the hospital. It's certainly important for hospitals to also be aware of key deadlines and ensure there's a plan in place to address them with IT developers and other healthcare vendors that they may have in place. So there's a few key deadlines here. We've passed a couple of them already. So on April 5th, 2021 was the applicability date for information blocking provisions. October 6th, 2022 was the EHR definition to no longer limit it to EHI identified by data elements in the USCDI. And then upcoming on December 31st, 2022, we have the new HL7 FHIR API capability and other criteria that must be made available. And then finally, on December 31st, 2023, the EHI export capability must be made available as well. So there's a much more technical and in-depth timeline that I can send out after this presentation as well. Also, it decreases healthcare costs and provides funding to promote these initiatives for the hospitals. All right, so moving right along to patients, which is right underneath the hospitals and physicians. This does impact patients because patients must have access to their patient data if requested, commonly through patient portals or, like I said, from printed EHR records. This allows for increased visibility and access for patients. Interoperability will also increase patient outcomes as dangerous drug interactions increases communication and collaboration across the continuum of care, and it provides more real-time visibility across parties. Finally, it also increases efficiency and delivery of innovation to patients. All right, and moving right along on the left at the bottom here, we have IT developers. I believe that IT developers are the most impacted party, as this act directly impacts their workload, expertise of solutions and interfaces, and resourcing needed to remain compliant. I believe that it has the largest LOE or level of effort associated with IT developers. So we see here on the slide, there's quite a laundry list of items that IT developers will be impacted by. They'll be tasked with increasing interoperability through software, and this will require expertise of interfaces and EHR functionality. It also requires developers not to engage in information blocking, which is preventing or interfering with access, exchange, or use of electronic health information, as there's a strong focus on healthcare data sharing that the federal government has implemented. This may mean setting up patient portals for patients to access their data more easily. They also need to track to those key deadlines that we discussed earlier. So this means that health IT developers need to be aware of API capabilities and CCDS technology, as well as implementation and maintenance of that said technology. EHR developers have 24 months from the publication date to update their technology and make available to their customers according to CMS. They are also responsible for potentially enhanced security criteria that may be a focus, such as encryption authentication credentials and multi-factor authentication, which will need to be attested as to whether or not they will be supported. It also increases and promotes innovation of technologies, medical product development, and research. And then finally, it eases the regulatory burden associated with the use of EHR systems and HIT. So although burdens are decreased, we can see that the level of effort presented to IT developers is quite lengthy. All right. So that wraps us up for today. In conclusion, overall, the 21st Century Cures Act was a bipartisan legislation signed into law in 2016 in an effort to help accelerate medical products development, bring new innovations and advances to patients in an efficient manner, and increase access and interoperability for patients and providers. It also brings on many other benefits to hospitals, physicians and clinicians, IT developers, patients, and other staff. However, those patient groups may be those various groups may be impacted in different ways. IT developers certainly encounter the largest impact to their roles during this healthcare technology-focused transformation, and it's very important for hospitals to be aware of the 21st Century Cures Act and what it entails to remain compliant as a hospital and reap the benefits posed by this act, such as decreasing healthcare costs, increasing patient outcomes. They have increased funding, ease of regulatory burdens, and increased efficiency and innovations across the industry, as we discussed earlier. So like I said, that wraps us up today. If you have any questions or concerns, certainly feel free to voice those here. Otherwise, I'm also available via phone number, email address, or you can reach out to me at my website here on this final slide. So thank you so much for joining, and I hope you have a great rest of your day.